Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor, available on Amazon. I wanted to do this video 2 days ago to piggyback on my prior video, 5 years follow-ups for life, to talk about the need for following up after the oncologist dismisses you after you hit that 5-year mark. I wanted to show you in real time what a survivorship plan and the different doctors that you may have to see, how to coordinate all that stuff. This is the second week of my 2 weeks that I do throughout the year that I have these follow-ups for all the late side effects that I deal with as a result of my treatments 37 years ago for Hodgkin's lymphoma. I wanted to give a day-by-day reporting to show what this practice of long-term survivorship care looks like. However, I hit a mental snag on the first day, and it was enough to knock my focus off enough. You know, John Lennon once said, life is what happens when you're busy making plans. And admittedly, I was already having difficulty with my focus before even that appointment, as I have a close family member right now who's ill. And because I've already had these appointments scheduled more than 6 months ago, I need to be in both places at once, and you can't. And like I've mentioned before about the airplane analogy, if the cabin loses pressure, an oxygen mask will drop from the ceiling. Put your mask on first before helping anyone else. And this is one of those situations. If I don't take care of myself, then I'm no good to that family member. Now, I see a number of specialists during these weeks, and they're all coordinated well in advance to see as many as that I can fit in, and to get as many of any studies they want to get done. When I first started this strategy, it was a couple years after I realized that I was no longer just a cancer survivor going through life. I was a cancer survivor with late side effects. And between the doctor I found who understood this need and my primary care doctor of nearly 40 years, this process went flawlessly, seeing who I needed to, having tests that I needed, and any surgeries or corrections that had to be done or completed. And then, as was their well-earned right, I would never begrudge them, they retired. But I felt confident that I had learned enough to be able to navigate my survivorship with all the new medical specialists and doctors I would bring on to my team. I'd learned so much what needed to be done to help my survival. Turned out I was wrong. Without those two advocates that I had of mine, I'm lost. I can admit that. I'm now finding myself making brash decisions, not necessarily in my best interest, but worse, struggling with the foundation of my care, trust. I won't get into the full issue because it's not what I want this video to be about, and therefore I'll do my own video on that type of post. But whereas I usually have my issues with healthcare normally steered towards the insurance companies and corporations, I felt that morning, in absence on Monday, the absence of the backbone of medical care, medicine itself. So yeah, I'll get into that on another video. So my week has gone as it was on paper with my appointments. The very first thing that happens with me, I get blood work done and with a multitude of tests. Now, I always tell them I'm a difficult stick, as my veins were destroyed by my chemo, as ports were not available. And you know, you've heard me talk about that. If they offer you the port, get it. Okay? Normally, this is the most stressful thing for me, yet this particular lab that does my blood every visit when I come here, they're the best. And actually pain-free and lots of success. It actually ends up being one of the least stressful parts of these process. From there, I was off to have a chest CAT scan done to follow up lung nodules, as I have one that's suspected of being lung cancer. This is due to the radiation therapy that I went through. There's always a concern about me being exposed to more radiation on top of the lethal amount that I had for my Hodgkin's treatment. But as this is following a situation that needs to be followed and possibly dealt with, the risk is worth it. From there, it was my first discipline that I see, pulmonology. With the scan done, it gets reviewed immediately, compared with prior scans for growth or development, and the decision is made what to do next, or if we're on to the next level of care, an actual biopsy of that nodule. But for now, this scan has revealed little growth or not enough to warrant doing a biopsy at this time. So that biopsy carries its own risks, which I don't need right now, so see you next time. My next appointment was with what I consider the most important of my survivorship care, as it always gets the most attention, and that's cardiology, my heart. Of course, today I arrived with a new symptom, the same symptom that took me to the ER 2 weeks ago, a swollen right arm and hand, which I showed previously. When I arrived, the swelling was just as bad, if not more, than 2 weeks earlier. But now, to be transparent, though I disagree with why, today's appointment I was only scheduled to see the nurse, not my doctor. And that's per the rules, corporate or insurance, I don't know. Again, that's going to be a different video. But today, I want to be clear. I respect all my nurses, okay? I appreciate everything that nurses give and do. But at that appointment on Monday, I needed to see the doctor. Okay, I felt this was an emergency. Now, regardless of my concern, I gave the nurse the benefit that surely he would bring my doctor in to look at my hand and arm. Instead, he told me of the results of the CT scan that happened, or told me about the CT scan that I was going to have the next day. I knew this already. He reviewed my prescriptions and did some vitals, and that was it. I said to him, is there any chance that the doctor can just come in and take a look at my hand and arm in person so that she can see what I'm dealing with? And the answer was no. And at that point, my heart sank, and so did my stomach. This had never happened to me before. My other doctors would never let this happen. I've been at this survivorship stuff for 16 years now, but yes, that was with my advocates quarterbacking everything. And I thought I knew enough and had the confidence that I could continue my care the only way I had known. I was wrong. I was crushed. I left the office feeling my survivorship care was now ending. No longer allowed to see my doctor, especially when I needed the most. I'm definitely shaken. I felt I had only one hope, which would be the next morning, since I could not get cardiology to be concerned. I was seeing vascular, responsible for my carotid arteries, impacted also by the radiation therapy. I had a stent placed in my carotid artery 7 years ago. And as soon as the ultrasound was done, I was in the exam room. First, the scan showed the carotids were still doing well, and then the attention turned to my hand and arm. He knew I still had that CAT scan to be done later that would show anything vascular as a potential cause. But he offered me another possibility, and something quite common among Hodgkin's survivors and breast cancer survivors, lymphedema or lymphadenopathy, a swollen lymph nodes, something I did not want to hear any more than a blocked vein or artery or a blood clot. If it turned out to be lymph-related, he arranged for me to add yet another specialist in my long-term care. I was originally scheduled to have 2 CAT scans, but that would have meant being exposed to double the radiation, and it was a last-minute decision and availability of a special machine, but they were able to combine the 2 scans together. That news brought other good news, in that the contrast would be used. It meant only trying to get an IV into my hand one time. The scan was completed in about 10 minutes, and the results were available later and shared by my doctor. The good news is the CT showed nothing vascular or blood clots, but it does show some lymph concerns, as he thought as a possibility. So it looks like I could be looking at something in my lymph system, lymph nodes, possibly Hodgkin's again, even after 37 years. I'm in a critical spot right now, though, and I want to make the right decisions, which clearly means I have to have my quarterback to make sure I don't make any foolish decisions, all the while I'm dealing with my ailing family member at the same time. This was my harder post to do, so I'm going to wrap this one up, and hopefully my next post wrapping up my medical visits for this week will be a little more smoother and a little bit more positive. Until next time, this is Paul's Heart.